3, 2, 1.
Do you have fatigue caused by low thyroid function from Hashimoto's? In this episode, we want to talk to you about some treatment options that can help you feel better faster. Hi, I'm Jake, one of the pharmacists here at Flourish, and I'm with Keith Bishop, our clinical nutritionist. And today we want to talk to you about some treatment options that are on the cutting edge of Hashimoto's disease, and some options that can be compounded just for you. So Keith, what exactly is Hashimoto's?
Hashimoto's is where the body's immune system is attacking the thyroid.
Okay.
And it is a hard to find disease because most practitioners, most doctors are not testing for what's called TPO, thyroid peroxidase. And that chemical is elevated when this immune system problem is going on.
Okay.
And the person can have some fatigue, may not really know it. The rest of the thyroid numbers can be normal, but it's that TPO is the easy to get test. That's the main thing.
The TPO? Okay. How do we get that test, or how can someone go about getting that tested?
Sure. Yeah, TPO, thyroid peroxidase. Matter of fact, there's going to be several large words, and we're going to put that on the screen for you too, so you can look at this later. But that TPO is available from your practitioners, or we're going to have a link on our blog where you can go to and get a blood test for that.
Okay. So let's say they do get diagnosed with Hashimoto's. There's a couple things that we can do here at Flourish to help them in response to that. What are those?
So yes, we have two products that we've started using recently. One is low-dose naltrexone. We call that LDN for short. And another product that's got 3 ingredients in it: myo-inositol, selenomethionine, and vitamin D3.
Okay. So how did you come up with this formulation? Because it's actually something we've been working with here. How did you come up with that combination of a capsule?
Well, and so I've been working with doctors for a long time. We've had practitioners, and we work with the local doctors. They want something for their patient, and Hashimoto's is one of those is very difficult. And really, besides traditional thyroid medications, there's not a treatment for it. Yeah. And there is some success with diet. It's important, but finally we came across, and that's just reading, researching for the doctors, this triple combination.
Okay, awesome. And so what thyroid medication options do we provide as well?
Yeah, so there's the traditional levothyroxine, which is a T4 thyroid. That's what the thyroid makes. And when that's taken, that just kind of helps suppress the thyroid. So it's not as active. And the kind of basic theory is that the immune system's not attacking it, therefore. Okay. And that definitely helps. It will help lower thyroid peroxidase, TPO, but it's not really the answer.
Yeah.
And another thing we do is we especially make a combination of actually the T4 that the thyroid makes. The body turns that into T3, which we make and put that into a capsule. So we have a combination capsule, T3 with T4, and depending on the practitioner, we can customize that dose for you and make it either an immediate release or a sustained release. So each practitioner is different on what they like.
Yeah. And so you mentioned diet in there. So what role does food play in Hashimoto's?
Well, very important, and such a major step, difficult to do, but often there's a food that's actually creating some digestive issues. So anytime we're talking about autoimmune, it's this.
Okay.
And so there's some digestive issues and or almost like a food sensitivity, not like rash, itchy things, but it kicks up the immune system. And so one of the most common things is going to be gluten, but there could be other issues. Yeah. We should be able to eat some gluten, but we're just not digesting that right. So we have an autoimmune diet. That for this, along with another version that's a little bit simpler, would be a paleo diet. Okay. And so once again on our blog, we're going to have links to those where you can download those particular food programs. And then often one of the surprising things is that it's common that if we don't have enough stomach acid, we're not digesting our food right, we have larger particles, more food sensitivities, and so practitioners are finding that we need to actually increase stomach acid rather than take those acid blockers. Okay. So we work with our patients for that too.
Okay. Well, great. Well, thanks, Keith. So there you have it. Talk to us today if you want more information about any of this, or if you need to talk with your doctor about it, and we can see how we can partner with them to provide you the best care. Also, come talk to us about the diet options or maybe some information you may want on that. This is just another example of how Flourish can help you feel better faster.